Welcome to Infectious Diseases Rapid Review. Today, we will look at a study published in the October 2025 issue of Clinical Infectious Diseases, examining how linezolid dosing and pharmacokinetics vary among tuberculosis patients across North America. Linezolid is a cornerstone of treatment for rifampin-resistant and multi-drug-resistant tuberculosis, but it has a narrow therapeutic index and high blood concentrations has been suggested to lead to mitochondrial toxicity such as neuropathy and anemia. Currently, standard 600 mg daily dosing is often utilized for mycobacterial infections, but there are concerns that blood levels could vary widely between patients. Therapeutic drug monitoring, TDM, has been proposed to identify potentially toxic troughs above 2 micrograms per milliliter and potentially subtherapeutic peaks below 12. The investigators analyzed 1,604 clinical samples from 500 patients collected between 2019 and 2023 at a single national reference laboratory. Specimens were collected from clinics and hospitals throughout North America. Patient samples included trough, 2-hour, and 6-hour post-dose levels. Most patients received 600 milligrams daily, while others used thrice weekly or alternate regimens. When evaluating troughs, the researchers found the median trough concentration was 1.19 micrograms per milliliter. Importantly, investigators found 34.6% of all samples and 43.2% of those on 600 milligrams daily exceeded the target trough of 2 micrograms per milliliter. When considering peak levels, 44% of all peak levels were outside the expected range, with 89% being classified as potentially subtherapeutic. After clinicians adjusted regimens based on TDM, 96% of patients with initially high troughs reached target levels by reducing dosing frequency and 68% by reducing dosing amount. These findings reveal substantial pharmacokinetic variability with standard dosing, leading to both toxicity and underexposure. The study authors suggest therapeutic drug monitoring allows clinicians to tailor regimens, improving safety without compromising efficacy. Although the study provides one of the largest real-world datasets of linezolid pharmacokinetics in North America, several important limitations should be acknowledged. First, the analysis cannot correlate measured peak or trough levels with clinical outcomes or specific adverse events, so it remains unclear whether therapeutic drug monitoring is superior to careful clinical monitoring alone, such as structured symptom screening, neurologic exams, or routine complete blood counts. Second, practical constraints limit broader adoption of TDM, including cost, turnaround time, and the need for specialized laboratory capacity and cold chain shipping. Third, incomplete paired sampling means that delayed absorption could be misclassified as malabsorption in some cases. Finally, the cohort may not be generalizable globally. These factors underscore that while TDM is promising, its real-world impact depends on feasibility, access, and integration with clinical judgment. For full details, see the study in Clinical Infectious Diseases. A link to the paper is provided in the video notes.